This video demonstrates the laparoscopic management of a gastric pouch migration following Roux-en-Y gastric bypass, using crural repair and gastropexy to the remnant sleeved stomach. The patient is a 55-year-old woman who underwent laparoscopic sleeve gastrectomy 10 years ago. She subsequently developed significant gastroesophageal reflux disease with a hiatus hernia. At that time, her weight was 87 kilograms, with a BMI of 33, and she had no significant comorbidities. 7 years ago, the sleeve was converted to a laparoscopic Roux-en-Y gastric bypass with crural repair for treatment of the reflux and hiatus hernia. She remained asymptomatic for approximately 5 years. She then developed progressive postprandial vomiting, eventually occurring after almost every meal. CT imaging demonstrated migration of the gastric pouch into the mediastinum through a recurrent hiatal hernia. Revisional surgery was therefore planned. At laparoscopy, adhesiolysis is performed to obtain adequate exposure of the hiatus. The gastric pouch is carefully dissected from the adjacent remnant sleeved stomach. Dissection is continued circumferentially around the hiatus. The herniated gastric pouch is progressively mobilized with careful mediastinal dissection to obtain adequate intra-abdominal length. The gastric pouch is then completely reduced from the mediastinum back into the abdominal cavity. After adequate mobilization and exposure of both crura, the hiatal defect is repaired with cruroplasty, restoring the anatomy of the esophageal hiatus. Attention is then turned to the remnant sleeved stomach. The proximal remnant sleeve is adequately mobilized to allow it to reach the region of the gastric pouch without tension. The mobilized remnant stomach is brought alongside and behind the gastric pouch. A gastropexy is then performed between the remnant sleeve stomach and the gastric pouch, providing additional anchorage below the diaphragm and helping maintain the pouch in its intra-abdominal position. The final view demonstrates the reduced gastric pouch, repaired hiatus, and the remnant stomach secured to the gastric pouch. This case highlights a surgical option for the management of symptomatic intrathoracic gastric pouch migration after Roux-en-Y gastric bypass, particularly in the setting of previous sleeve gastrectomy and recurrent hiatal hernia.
Generate by AI.